Hey, you guys, welcome to our daily practice questions in preparation for the boards of ANCC and AAMP. Before I get into any of my material, I always like to give my introduction and disclaimer. So, for those of you who know me, hey, y'all. For those of you who are new here, welcome, you guys. Welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate on all of our courses and 100% pass rate on our one-on-one sessions. But I always like to get into my disclaimer to let you guys know, there's no absolutes in medicine. Y'all know that. And so we treat on a patient by patient basis. So when I provide questions, I give questions based on what they are currently utilizing those guidelines on ANCC and AAMP. And when I'm teaching you on certain things in practice, I will always say that because those guidelines can vary, and I'll tell you that so there's no confusion. But with that being said, let's get into our question for today. So, question number one states, the nurse practitioner has meningitis as a differential diagnosis and is planning to complete additional assessments to confirm her differential diagnosis. The nurse practitioner has the patient supine and lifts his head. As she lifts his head, he bends his knees. Based on these findings, this is a positive result for which test? Is it A, Kernig sign, B, Brudzinski sign, C, Rovsing sign, or D, Murphy sign? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first to ensure that you are answering what is even being asked, right? So here the stem of the question states, based on these findings, this is a positive result for which test? So let's take it back. So you're trying to figure out what's a positive result. Let's see what even happened. So when the nurse practitioner did the assessment, she had the patient lying supine, lifts his head, and as she lifted his head, he was bending his knees. So what is this positive for? What is this a positive? What type of test is that positive? Is it Kernig sign? No. Although we do utilize Kernig sign to help confirm a meningitis diagnosis, that's not Kernig sign. Kernig sign is more where you have them lying supine, you'll lift the leg and it'll elicit pain, they can't lift that leg. And then Brudzinski sign, is that it? Yes. B, Brudzinski, also for meningitis confirmation, remembering that, hey, while they're lying flat, as you lift the head, their knees will flex up. They'll start to bend those knees, okay? So it is B, Brudzinski sign. And the other two don't even have anything to do with this, right? All right, question number two. A mother brings her 1-year-old son to the office today with complaints of painful reddened areas on his face. As the nurse practitioner assesses the patient, she notes a honey clustered rash to the patient's face. Based on these findings, how should the nurse practitioner treat? Is it A, ciprofloxacin, B, doxycycline, C, cephalexin, or D, nothing? It will resolve on its own. Take a moment and tell me what you got in the comments. All right, the stem of the question states, based on these findings, how should the nurse practitioner treat? I always tell you, if we're looking for a treatment, you need to run it back, right? And see what the diagnosis is. How did the assessment show? Like, what was the presentation? What did they state was going on? What did you observe going on, right? So that you can continue to build and tell us how to treat that, because I tell you to always, I teach in assessment, diagnosis, evaluation, treatment. I tell you to study in that fashion because that's how we practice, that's how we document, that's how they test us. If you listen to any of my courses or any of my practice questions or anything, you're probably sick of hearing me say that, but trust me, that's the name of the game. Okay, so all right, so we need to take it back and think of what diagnosis the patient presented. Complaining of these painful reddened areas, right? That's the subjective. Objective, the nurse practitioner notes honey clustered rash on the patient's face. All right, so to get to that diagnosis based off that assessment, here comes that key identifier, and I tell you, my little thing, like when I say this, you say that. When I say honey cluster, you say impetigo, right? Impetigo, I say impetigo. But when I say honey cluster, you should think instantly impetigo, right? Right? Yeah. So how do you treat that? So is it A, ciprofloxacin? No. B, doxycycline? No, this is a 1 year old. Remember, and we're not giving tetracyclines to the little kiddos. You don't give tetracyclines to pregnant women, and you don't give it to the kids under the age of 9, right? And then C, cephalexin. Yes. And I did this purposefully because make sure that you know medications, generic and brand name. So also known as Keflex as the treatment option. But on some of the exams, they will give you both names. Some is just going to give you one or the other. So don't miss a question just because you're just used to knowing Keflex and not knowing any other brand or generic name for the medications. Okay. All right, you guys, question number 3 for today. A patient presents to the office with complaints of pain to the inner part of his elbow. He states that he has played golf for years, but recently began to experience this increased pain. Based on these findings, how should the nurse practitioner diagnose? Is it A, carpal tunnel, B, lateral epicondylitis, C, medial epicondylitis, or D, the patient will need to follow up in 1 week for further evaluation to diagnose? Take a moment and tell me what you have in the comments. All right, you guys. Stem of the question states, based on these findings, how should the nurse practitioner diagnose? All right, so let's run it back and see what the assessment findings are. The patient came in. How did they present? They came in stating that they're having pain to the inner part of his elbow. This should start to raise a flag, right? Then he says he played golf for years, but recently began to experience this pain. Well, you should start to think about the epicondylitis, right? But then you can go back to location. That inner part of his elbow is classic for medial epicondylitis, right? C. Then what confirmed it is that he plays golf and has for years. You know, it's commonly known as a golfer's elbow. And then the lateral epicondylitis, the outer part of his elbow, so that would say out, the pain is to the outer part, is the lateral epicondylitis, also known as tennis elbow. And this stuff is caused by constantly doing those repetitive motions that has caused this area to be inflamed. And it's typically repetition will cause this to flare as flare more is what I'm trying to say. And then basically they just need to rest it. They need to sit out on the golf for a little while and rest that elbow. But yes, C, medial epicondylitis. And I'm going to take it back real quick, too, to question number 2, because I just want to give this tidbit. Remembering with impetigo, honey cluster rash, Keflex is a very common antibiotic treatment for this. But also, a question that I get a lot is when are they no longer contagious, especially in the kiddos? But it is 48 hours after the initiation of antibiotic therapy, right? And it's also once it's completely crusted over. So either or, but standard is 48 hours after the initiation of antibiotic therapy. And typically it's like a 10-day span. Um, but they typically are not symptomatic until like 4 to 10 days of it. So they're honestly, unintentionally been contagious and spreading this initially. But yes, just a little sidebar to know that 48 hours after the antibiotic is when we deem them no longer contagious, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But be sure that you meet me back here if you need assistance with preparing for boards, if you need our review courses, review book, or if you want to do a one-on-one session with me to help you either take your weaknesses to your strengths, or if you have been unsuccessful previously on boards and really are just stuck and need some structure, you need to figure out where your true weaknesses are and how to re-navigate your studying and be guided through that, then just let me know. We can schedule a one-on-one session and a custom plan to get you prepared for boards to go from unsuccessful to successful. But just reach out to the nursing studio. Just give us a call at 803-400-6864 or shoot us an email at thenursingstudio1@gmail.com. Bye, y'all.